In this presentation, my task is to um, debunk some of the common myths. There are many myths in cancer diagnosis, treatment, and how the entire journey of the cancer patient takes place. It's not one or two, because every time when we sit in the OPD, when we talk to our patients, um, they all come with unique questions. Every time there are some times when we get very unique questions which I wouldn't have thought of last time. So what I have done is, I have compiled a few common myths which I come across, and I want to clarify those things in this particular. There are about 10 or 15 of them. So I'll be clarifying as I go on. So, so that is the purpose of this entire talk. So, what is the what happens when you really have some thought or something which is there? See, usually what has happened over the history is some ideas people develop and it becomes very popular over time. Like there was a time when everybody thought and the entire science thought that egg yolk is very bad for health. Everybody thought, but then suddenly over time the things changed, right? Today we believe yolk is okay to have. The scientific evidence is not very strong to avoid egg yolk. So like that only things have changed over the years, and more evidence has accumulated to tell us that no, what we thought previously was wrong, we need to rethink about it. So what we are going to do today is we'll go through this, the scientific evidence for some of the things which common man can understand, and we will debunk those. The purpose is this, see, when there are wrong ideas, you people get into needless worries and end up making wrong decisions. So the whole idea is that we have to avoid these wrong decisions at the end of the day. So accurate information will make you empowered. You will be able to take right decisions for the right, you will be able to take the right decision at the right time. Now, first very common myth which is there is cancer is a death sentence. People think, oh, the moment I have cancer, that means it's the end. There is nothing which can be done. But the fact of the matter is, things have significantly changed over the years. There are many therapies which are coming. If you had talked about a situation in the 1990s and all, it was a problem because the treatments which are available at that time was very less. It was very less, and people would surely get into trouble because of getting cancer. So the survival rates were so bad at those days, and we used to talk about cancer as a rare disease. The things have changed. Today cancer is one of the most common diseases. It's in the top 3 everywhere. So the things have changed and the treatment has changed. And if you look at the survival rates, especially for early cancers, it is phenomenal. Today we can boast about 90% cure rate in most of the cancers if the patient comes in time. So individual outcome depends on many factors that we have to remember. There is a patient factor, there's a disease factor, and there's treatment factor. So disease patient factor means patient's fitness, how well the patient understands the treatment and goes through it in a systematic way. Because if a patient doesn't understand, many times patient is uncooperative and does not go through the treatment. So going through a treatment is very important for the patient. So patient factor is important. Fitness of the patient is important. Disease factor is very important because some of the cancers behave very aggressively. So those aggressive cancers don't do well. So again, that factor comes in. And the wrong kind of a treatment is constituted is also a problem. If you give wrong treatment, the outcomes will be wrong. So there are times, I have seen many patients, suddenly some doctor will, the moment they see the patient, they'll say, tomorrow I have to operate, tomorrow I'll do the surgery. Wrong. In cancer, cancer is not an emergency. Cancer is a disease where you have enough time to make a proper planning because there are multiple treatments involved. There are a lot of planning that is involved, and it has to be done in a very systematic way. You have to put, most times we put the full planning before we start treatment. So the treatment factors, whether the treatment was given correctly or not, also matters a lot. So that is one. Second very important thing, which I wouldn't number second, third, and all that. I'll just go on talking about it. But other very important thing which we think, which people think about, is eating sugar will make your cancer worse. I'll answer two things here. One, cancer cells do consume sugar. They are known to consume sugar more than normal cells. It is very true. But in short term, when the person, there is a patient who has cancer, if they consume sugar, there is no evidence that tells us that it will make it worse or grow progressively and make it worse. No, because I get a lot of patients who come to me, they tell me, patients, sons and daughters, very often they'll say, no, I have stopped all sugars for my father or mother. That is a very common thing. But the fact is, that evidence, there is no evidence to tell you that sugar will make it worse. In fact, it cannot, also scientifically also, if in the short run, when if you talk about, like, during the treatment or after treatment, it's not how it works. The How it works is a long term consumption. It is about, all about, the duration. If you are consuming huge quantity of sugar over the years, then it can lead to excess weight gain, that is obesity, and that can lead to cancer. So that is how the progression, the available evidence is like that. Other evidence which is there is, insulin. Insulin is a growth hormone. So if a diabetic patient and a person who consumes a lot of sugar produces lot of insulin. I'm sorry, some issues. Yeah. So a lot of sugar, a lot of insulin. So that itself stimulates the growth of cells, and that can cause cancer. So that is the theory. So should a person who's diagnosed with cancer suddenly stop all sugar consumption? The answer is no. It does not change anything. Okay. So when I say that, it doesn't mean that you gorge on sugar and consume huge quantities of sugar. Everything has to be in moderation. Even the in Indian terms, amrita, what we call, the elixir, that is also poisonous if you have too much. So there is nothing that is not poisonous. So yeah, poison is in the dose. It is not about which is poison. It's all about dose. If you have too much of anything, it is poisonous. Now, uh, other very common thing which comes up, which I come across, is a notion that cancer is contagious. Patients come and ask me, can, or the sons and daughters, can, I have a small child in the house, so will that child be at a risk? Will it spread to my child or to anybody else? Can we eat in the same plate? Sometimes they ask that question. See, cancer is not a contagious disease. It does not spread from person to person. It is not possible at all. So, what happens, if at all, in cancer, is, you know there are some cancers which are caused by infection itself. Like, for example, there is a viral infection like the human papilloma virus, which causes cervical cancer. There is hepatitis viruses which can cause liver cancer. HIV can cause some cancers, and there are some bacteria which can cause cancer, stomach cancer. So these cancers are not like, you get infection today, tomorrow you'll get cancer. These cancers happen because of the infection which lasts for 10 years, 15 years. It takes a long duration of time. So this is not a spread of cancer from person to person. It is a spread of the infection. This were, 99, 90, more than 90% of the people who get this infection do not get cancer. It will be eliminated by the body. So cancer per se does not spread from person to person. Now, other side of it, I'll tell you. Who said danger? Usually, when we give any treatment for cancer, chemotherapy, or anything, the immunity of the individual drops. Actually, the patient, cancer patient, is at risk from rest of the family because they can carry an infection to the patient. So that is something which you should be cautious about. And other important point which I made over here is a possible uh, one possibility which we always keep in mind is a patient who or a cancer patient cannot give an organ for donation. So if somebody had cancer even 10 years, 15 years before, if they think, okay, I'll donate my kidney to somebody else, that kidney cannot be accepted. The reason is the tissue transplantation. There is a small risk, 2 cases per 10,000 patients transplanted. If they have cancer, there is a risk of that cancer regenerating in the transplanted tissue. So that risk exists, and for that reason, that is not done. Generally, it is not accepted as a donor. Now, other important, very often, which come, many people tell, my father or my mother or I have a very very positive attitude, and attitude will make the person win. Attitude makes things better. I know our uh, you know psycho-oncology talk will tell you about it. Dr. Jaitri will be talking about it. But attitude matters. Attitude matters because you need to go through the treatment. But will it make a difference in the scientific outcome? The answer is no. But is it important? Yes, because you need a winner attitude to go through what you have. You need to understand that okay, I'm going to do it. You because it is not impossible. You to win in anything, a positive thinking is very important. But scientifically, doesn't make, if you're dull when you're taking chemotherapy, doesn't make a scientifically does it make a difference? No. The answer is no. Now, coming to the next question, cancer surgery causes cancer to spread. Very, very common problem. Patient comes to us and says, I have heard that surgery will spread cancer. In fact, it's one of the most foolish notions that many people and possibly it has come out of very bad surgical techniques of some of the surgeons. Probably that has caused, because it's like, I always say it is like, when see, if there is a waste in your house, you have to carry it and throw it out of the house. But if you make a hole in the waste bag and carry it, it is going to spill everywhere, so it's going to spread. So basically the idea is that, it should there is a meticulous technique which is involved in cancer surgery, and if that is followed, the whole intention of treatment of cancer surgery is to remove the tumor, so it works beautifully. That surgery constitutes for 80 to 90% of cure rate, in, especially in early cancers. In fact, that is the only thing which is required in many cancers. So metastasis, what we call, cancer spread is actually called metastasis. Okay, there's a terminology, medical terms for term for spread. It happens because of breakaway cells of the tumor, and it's a complex biological process, and it's not generally caused by surgery. But technique of surgery is very important. That is followed always by all the most of the surgeons who are trained in that. At least the cancer surgeons will follow that. And there is proof to this also. Clinical studies have proven, because when such kind of a question comes, there are studies which have proven that, it does not affect the out, cancer does not spread off because of surgery. Multidisciplinary approach treatment is the key for cancer treatment today. One treatment does not help. The very reason why we have been successful in cancer treatment is because we are able to give multidisciplinary treatment. Okay, so there is evidence, there is enough evidence. In fact, there are large clinical trials which were done because of this myth itself that has been done. There are studies which are including, 34,000 patients, more than 1 lakh patients. All of them have categorically told that there is no evidence that surgery will cause a spread of cancer. Now, another very common question is, if I get a biopsy done, suddenly it will spread. The fact is, again, I'm just giving you the evidence that, there is enough evidence. There are, these are cases, these are published studies where they have studied more than 6,000 patients, more than 2,000 patients, and they have conclusively proven that in most of the cancers, biopsy does not spread the disease. And biopsy is essential to make a plan, because without biopsy we cannot say that this is how the planning is, this is what we are supposed to do. The biopsy is required to make a proper planning for cancer treatment, so it's very important. And another important point when I say this, there are certain organs where we do not do biopsy. I have given it below here: ovarian cancer, gallbladder cancer. If we see that it is an early cancer where we can do direct surgery, we do not prefer to do biopsy, because gallbladder and ovary and all are like cysts. They're like fluid-filled cavities. You put a needle, it can burst. Stage 1 can become stage 4. So the decision process depends on what is the stage. Early cancers in gallbladder and ovary, we don't do any biopsy. So don't generalize things. Another very important thing, because if we tell something for one thing, generally people think, okay, everywhere else it will apply. It does not apply. It applies to only that area. Another very common thing: cell phones cause cancer. Very people are making a lot of noise about this. Again, I went around getting the evidence for this. There are very large studies which have been done on this, especially for brain cancer. They thought that there is evidence it causes. But the fact of the matter is, after all this, more than 7-8 lakhs, 3.5 lakhs people they followed up, they took studied it, and they published finally that there is no evidence of uh, that it causes any brain tumor. It was for brain tumor. Interesting story here. What happened was, initially when newspapers gave a good publication, published this thing very aggressively, telling that cell phone use can cause cancer. But how they did this study was, uh, they asked people who had brain cancer, did they use the cell phone more on that particular side? Okay, and all of them said, yes, yes, I used on that side more. But what it turned out was, you know that was a false representation, because you are looking at the memory of the patient, you are asking them what they did. And always there is a recall bias. People will have a bias to say that, okay, I have, because I because the person is asking, they'll say, no, it is cause it is there on that side. So eventually what they realized was, use of cell phone decreases the incidence of brain cancer on the opposite side, which means it's contralateral. So it decreases on that side. It's below the normal population level for surprising reason. Means it was actually not a real result. It was biased because of the memory recall. So the fact today is, there is no evidence to prove that it causes. And I'll tell you another bit of science. The radiation emitted by cell phone is not ionizing radiation. So ionizing radiation is known to cause cancer. Non-ionizing radiation is not cancer carcinogenic. It does not. Okay. Now, herbal products can cure cancer. That's another thing, very common problem. People, there are quacks, lot of quacks who say, I'll cure cancer and all that. But the problem or the thing is, they don't have liability. Nobody's going to sue them in the court, or nobody's going to take them to task. So the fact is, there is no reliable evidence to tell that it will cure. And the fact is, potentially, there are many herbal products which can be very harmful to you on direct consumption. And especially if you take it along with chemotherapy or radiotherapy, it can be more harmful. In fact, we are very scared of herbal products because they have multiple things in them. It's not purified. So they have other contaminants. There are so many other things. It's an uncontrolled product. There's no quality check. So many things can go wrong when you consume a herbal product. So it is very herbal products in the sense I'm talking about, not already branded good quality stuff. I'm talking about those things which you purchase from a quack on the some forest or something like that. They are quite dangerous. So be very cautious. Don't go for it. They have a lot of side effects which are not known. That is a problem. It's not documented, so you don't know. So you'll end, once you end up in trouble, only you'll come to know. Other important thing very commonly we come across is, if somebody in the family has cancer, I'll get it. The fact is, no, it's not that simple. The incidence of what we call as hereditary cancer is only about 5 to 10%. So it is not that everybody, if one person has cancer, you have a high risk. There is very particular way in which we assess that. A genetic counselor will tell you that, this is the way we go about. So there are certain criteria which we use. I don't want to go into it, but the answer is the possibility of anybody getting cancer because of inherited genetic defect is only 5 to 10%. It is not more than that. Okay, so that is very important to remember. So again, another very common thing, antiperspirants, will they cause tight bra? Does it cause breast cancer? Very common question which we come across. In fact, scientifically, it is not possible that tight bra will cause any cancer. But when it comes to these deodorants and antiperspirants, there was a compound called parabens which were known to be associated with they look like estrogen compound, which is a female hormone, which is known to cause breast cancer, but that also is not very strong evidence. If you there is a relationship, the structure of the molecule is similar, so it might cause, is one of the theories which is there. So and the fact is, most of the deodorants today do not have parabens, so that way also you're protected. Chemotherapy is painful. Mm, the answer is yes and no. Very often people come and ask, doctor, chemotherapy is painful. I'm worried. In fact, the most common thing, painful factor of chemotherapy is the pricking itself, and that we can avoid by using what is called as a chemo port. We don't have to, uh, keep on pricking the patient for giving chemotherapy. There's a device called chemo port, which is put, which makes chemotherapy most painless and comfortable. Now, coming to the other factors, yes, there are some factors which could be painful, like the oral ulcers, which are mucositis and all that. There is some, because we give injection for neutropenia, means counts going down, that can cause some amount of pain and all that. But the most common cause of pain, which is multiple pricks, which the person has to go through, that can be completely eliminated by using chemoport. So by far, I have covered a few myths which I thought were important for a person who's going through, uh, cancer therapy, and the family also needs to understand it. And those I have covered in a very brief fashion, as good as I could. But there are much more to talk about, but I don't think this is the forum for that. Thank you very much.
Thank you so much, sir, for this amazing presentation. I'm sure that our patients and caregivers are benefited by this presentation.
If there are any questions, I can take it now also.
Um,
I,
patients and caregivers are kindly requested to share their question we have with us, Dr. Nayak himself.
Somebody has asked, can sugar-free, okay, sugar-free products. See, recently WHO has designated some of the sugar-free molecules as, causative factors for cancer. They have, but see, the evidence is not very strong. Uh, and also other factor you have to remember that, there is evidence that sugar free does you may think that it will reduce your calorie intake, but the evidence today says that it does not, because what it does is it cheats your brain into thinking that you are consuming sugar, but in turn your desire to have sugar, because it's not giving you calories, so your desire to have more calories to compensate it may happen. So there are many dietitians today are recommending that avoid it, control your diet, don't consume too much sugars. And there are many sugars which are just literally hollow calories. You can actually not you can survive by not taking them, so you can avoid it and you can be comfortable. So the answer is moderation. Even if you're taking sugar free, don't gorge on it. It's not going to change. It can be worse than having sugar for you. And try to live on less amount of sugar. I'm talking about raw sugar, the refined sugars, which includes jaggery. And where there is a people think jaggery is safe, honey is safe. Actually, all are sugars. None of them are safe, whether it's natural product, unnatural product, chemical, human manufactured things. None of those things are safe, as well if you don't consume those things in moderation.
Thank you, sir. We have another question from your patient, Mr. Raghavendra Bhuramurthy. He has
Okay.
asked us, my lobectomy was done by a team headed by Dr. Sandeep Nayak in August 2021.
Okay. Okay.
So I am on adjuvant oral chemotherapy with one tab Tagrisso osimertinib 80 mg per day since 7th October 2021. I am asked to take it for 3 years. At 6 monthly intervals, I am asked to have a PET scan done. As the PET scan involves nuclear medication, will it not have any side effect? And her second question is, if the next PET scan sometime in February, March 2024 is negative, can I stop Tagrisso? If yes, should it be done in phased manner? That is by tapering the dose and the interval between two doses?
Very good. It's a purely clinical question. Okay, so I'll just put it in simple things. See, the dose which is given for PET CT, you know, is nuclear medicine dose is not going to harm you in any way. It is very, very less. It doesn't. It's not like a huge load of radiation. It doesn't harm to that extent. Uh, and it's eliminated almost within 3 hours. Your body eliminates it quite well. The radiation dose of CT scan is also is significant, but that also, see, when it is required to do it, you have to do it, because entire life is about balancing, right? There is a trade-off always. So it is not like you have to if it is necessary, you have to do it. Generally, we follow an yearly PET CT for most of the patients, but this situation, because of osimertinib or something like that, I think we would have changed some protocols in your case. And now, your drug duration is decided based on the protocols. It doesn't, and dosages are not generally reduced in midway through the treatment and all, unless you are not able to tolerate it. That is a policy which is followed. So it is not like it is not decreased in steps. It is stopped at a time when it is appropriate. That is how it is done.
Thank you, sir. Again, we have received one question. How well is the MRD well documented in India as a prognostic factor?
What is documented?
Uh, how well is the MRD well documented in India as a prognostic factor?
He's asking, he or she is asking about medical records. I think they're asking about medical records for. Is that the question? That is the question, yes. The documentation process in India is very bad. It's very bad. In fact, very few of a few centers and a few people really give lot of focus to the documents and maintain the documents quite meticulously. uh, because because I struggle and maintain it myself, and I invest quite a bit because I want to give quality at the end of the day. But it takes a lot of effort, and this one, there are technology and software available to do it. It's all software based, so everything that we do is using software, so we can generate data. Because very often I am involved in a lot of research, so we do maintain certain amount of high quality data, but by far, yeah, it is not as good.
Sir, I guess the patient is asking minimal residual disease.
Oh, because MRD can mean medical records also.
Yes.
So minimal residual. So what is the question? Minimal residual disease?
So minimal residual disease. The question is, uh, 1 second, sir. He has asked how well is the MR well documented in India as a prognostic factor?
See, MRD is used for lung cancer and many other lung cancer. It is being used quite extensively. Uh, so, in fact, it can easily be used for many other cancers where there is circulating tumor DNA in the cell, in the blood. So, in fact, we can easily do a test in the beginning of the treatment and middle of the treatment to see the response, and end of the treatment to see the residual. So that is done. It can be utilized, and it is available in India. And it can be done, but I think very often we are not using it in many patients. Some indications are a few, and people who can understand it, we can offer. That's how it is. So it's not like many other things which are today the standard of care. So it is just upcoming. At research level, there are many studies are using it, especially lung cancer studies.
Thank you, sir.
Something other question was there. What was it?
Yes,
Or
sir.
should I? I think yeah.
So one
She has
question.
answered it. Yeah. Okay. Yeah.
Okay, sir.
Right. I think we'll get late. Also, other things are there. You have to complete your presentation also. What should be the diet of an ileostomy patient with high stoma output? Okay. Diet, see, high fiber diet would really make a difference. I think, Sharmela also can answer that question, right? She's on this thing. So, high fiber diet will make a difference, but ileostomy output comes down over time. It becomes harder as it goes on. But yeah, let her take that. That's the main thing. Otherwise, we have to give medicines to reduce the motility of the gut. That also works, right? Okay, go on with. I think we should go on with the rest of the presentations. Thank you very much.
Thank you, sir. Thank you, sir, for this amazing presentation. I'm sure that this amazing presentation is extremely beneficial to all our patients and their caregivers. Now, let's welcome Ms. Jaitri Mandal, Senior Onco-Psychologist from 4 Base Care. Ms. Jaitri Mandal is a Senior Onco-Psychologist from 4 Base Care. She will be talking about the importance of maintaining good mental health and good quality of life during and post-cancer treatment. It's a pleasure for me today to introduce you to Jaitri. She is associated with 4 Base Care since February 2022. She has completed her MSc in Health Psychology and MPhil in Psycho-Oncology and provided around 1,000 oncopsychological consultation for patients and 4 base care till date. Over to you, Jaitri.
Thank you, Aditi, for this amazing presentation. And good evening, everyone. My name is Jaitri. I am the senior psycho-oncologist from 4 Base Care, Bengaluru, and I help to deal with emotional, behavioral, and social concerns related to cancer care for both patient and their caregivers. Before starting with today's discussion, we will be now presenting a small PowerPoint to briefly explain about what is psycho-oncology and how it really can be beneficial for the cancer community. Before starting with today's discussion, let's talk about a myth that is really very common in our society. That is, until and unless I am not psychologically or mentally absolutely disturbed or distorted, there is no need for me to consult any psychologist or even therapist. So now, today, in today's webinar, we all are present here, and we all know that in cancer population, none of you or the caregivers, they are psychopathologically ill or psychologically not in a right state. So now the question comes, why we need to visit a psycho-oncologist? Because cancer treatment really takes a long time, and during this time, patient can feel depressed and anxious, and sometimes they may develop post-traumatic stress disorder as well. So it's very important to find out the reason why patient feel distressed during the cancer treatment and how psycho-oncology services can be extremely beneficial for you. The first thought that comes into the mind during the treatment for any cancer patient, that is, why me cognition, in the sense, why the cancer has happened with me? Because always I have lived a very healthy lifestyle. My eating pattern was very good, or neither I have done any sin. So now why? The another symptoms that patients start experiencing, that is sleeplessness, and particularly at night. We have seen during the counseling session that patient can sleep properly during the daytime, particularly in the afternoon and the evening, but the problem comes to sleep at night. They start experiencing multiple anger and irritability issues, lack of interest, even stepping out from the home as well. They always try to stuck themselves into a small room and maximum bedroom, do not like to talk to other people as well. So other pain and biopsychosocial discomfort also they start experiencing, and body image issues. As we all know that during the chemotherapy, patient may start losing their hair, their skin color and the nail color starts changing. And also there are multiple surgical procedure as well. For example, MRM, that is the modified radical mastectomy, and probably head neck cancer as well, when they need to put a rice tube. During this, and the structure is changing rapidly, and it's not so easy for any patient or the caregivers to accept them the way they look now. These body image changes can really create multiple types of or multiple severity level of stress and anxiety within the patient. So it's very important that please consult to your therapist or your psychologist for a better quality of life. Now, in the next slide, we will be talking about other psychosocial concerns that may affect the cancer patient really badly. Another concern that comes in this time, that is fear of cancer relapse. We all know that patients start feeling that if my cancer relapses once again, multiple negative thoughts. For example, I'm spending so much money, I'm spending so much time and energy even after that. If my cancer treatment or the medication doesn't affect within my body at all, then what's the purpose of doing all this treatment? Patients start experiencing decreased self-esteem and self-confidence. Cancer-related is mostly common during this time, and also decreased physical functioning, reduced role and aspirations in life or career. We have seen it particularly within the survivors. Before their cancer diagnosis, anyone may feel that I would like to be a teacher, or probably I would like to be a businessman. But after the cancer treatment or during the treatment, they may find that probably I am not at all potential in doing anything. They start experiencing severe behavioral, emotional, and social deficit, majorly fear, anxiety, and distress, and they may start feel that probably I'm a burden to my family members, or probably at my workplace, everyone is talking about me and they are feeling that probably I am taking advantage unnecessarily because my cancer treatment is going on. As a result, we have seen that patients sometimes may start neglecting their treatment, they may deny their treatment, and also sometimes they may deny their diagnosis as well. So understand here, if because of the psychological distress, patients start denying their treatment and even diagnosis, definitely the prognosis is not going to be good. As a result, the entire well-being and quality of life can be deteriorated within no time. That's the reason it's very important that please to consult with a psycho-oncologist or therapist for a better quality of life, not only for the cancer patients, but also for their caregivers as well. Now, in the next slide, we will be talking about how objectively a psycho-oncologist is going to provide you the psychological counseling and what benefits you will be getting after that. Take one example before starting the discussion. If any patient who is a wife of a family is diagnosed with breast cancer, and for example, she is hospitalized now and undergoing the treatment, it's very obvious that the husband needs to take care of everything, including the household chores, managing the finance for the treatment, also his own job, also taking care of the children as well. As a result, there is also a probability that in the household, the dynamics between husband and wife may change, can be deteriorated as well. Not only that, in future, the relationship between the children and the parents can also deteriorate to a certain extent. So it's very important that if you want to manage a good family dynamics, not only for the patient, but also for the caregivers in the family during your cancer treatment, take recommendation or take a family counseling session from the psychologist who will be really very much helpful for you with certain suggestions and certain recommendations so that your family bonding within the spouse and within the children and the parents can be intact just like before. Now, let's look at the left side of the screen. Here you can see one scale. In this scale, you can see 0 to 1, which is below the screen. That is basically my patient's mood is fine. I'm very happy. But if you go on the top of the screen, you can see this is 8, 9, 10. It means my patient is not happy and my patient is crying. So this is the exact way how the psycho-oncologist work. If our patient is not happy, it means if they're upset or if they're experiencing any sort of distress, with the proper psychological therapy and intervention, we will try to put it down to the good mood, which means either 0, 1, or 2. As Dr. Sandeep Nayak has already explained about multiple stigma and multiple myths in our society regarding the cancer treatment, a psycho-oncologist exactly does the same thing. For example, if there is a myth that if you have a patient at your home who is now diagnosed with cancer, probably you cannot sleep beside that person. You cannot eat from the same plate, or probably you cannot use the same towel or same washroom. So these are myths. During the psychological conversation, when a psychologist will get to know about it, they will provide you the right information that how you are supposed to take care of your patient and also your own health as well. During the cancer treatment, patient and their caregivers may start experiencing multiple types of anger because of multiple reasons and irritability issues as well. So there, a psycho-oncologist will objectively recommend you multiple strategies to manage your anger and your irritability for better coping so that your overall quality of life can be better as far as possible. In the next slide, we will be talking about multiple stress management techniques for your better well-being. It's very important for us to understand that we need to keep our mind calm for our better health. And for that, the stress management techniques come into picture. Total 2 types of stress management techniques we usually recommend in counseling session. One is cognitive stress management. Another one is behavioral stress management techniques for particularly cancer patients and their caregivers. As a psycho-oncologist, I really prefer mindfulness breathing and if you have any friend or any well-wisher or even your therapist, try to open your heart out and try to talk to them. Try to release your emotions as much as possible to them through talking. If you feel that mindfulness meditation is really helpful for me, there are a few strategies that now we are going to talk about. First of all, you can do it at any point of time, either probably morning, afternoon, or at night before sleeping. Just close your eyes, make your body comfortable as much as possible, all the muscles. Just inhale from nose and breathe out from mouth, and make sure that during that time, your entire attention should be on your breathing pattern only. Try to make it maximum 3 to 5 minutes per day for each session. As we were talking about earlier, try to find out a friend or probably your colleague or probably any well-wisher to whom you can talk to. Because during the cancer treatment, the only conversation that usually we continue at our household, that is, when is your next follow-up? What all you need to eat from till morning till evening, and what medications you need to take today. But beyond that, every human has plethora of emotions, and it's very important that that also needs to be catheterized to anyone. What will happen after that? Your mood will be improved. Your anxiety is surely going to be reduced. If you have a place to express all the emotions that you are experiencing currently, your confidence level is also going to be increased. Also, your positive reactivity is also going to be increased. Now, in the next slide, we will be looking into the other cognitive stress management strategies that can be very much beneficial for all of you. For example, if you love painting or if you love drawing, that can be very much beneficial for you. And for that, just you need to take a white paper, some colors, and a pen. You can draw, you can paint, you can make a circle, whatever you like to do, just do that. Many of you may probably like to listen music or like to sing any song. It can be either contemporary or even spiritual music as well. Whatever you peace, whatever makes you happy, whatever can engage you throughout the day, try to do that. And let me tell you, for that, there is no need that you need to be an expert. It's all about catharsis, which means if anything we cannot express through words, we need a medium. And that medium should be, either it can be my gardening, probably a walking, or probably playing with my children. It can be painting, drawing something. It can be even listening music as well. As a psycho-oncologist, what I personally recommend to everyone, that is try to read or write something. The question comes that what should I write and why should I write? You can write anything. Just take a diary. You can write your name, your date of birth, today's date, or probably your age, your address, and what all you had since morning till night, and probably next day. What do you like to do? The question comes that why should I do that? Because during chemotherapy or other modalities of cancer treatment, sometimes patients may experience mild forgetting, sometimes mild confusing state as well. If you write and read on a regular basis, you will understand that you are not confused to some greater extent, like you are able to hold your memory at the right point. The first few days, surely your handwriting is not going to be good. But if you compare your first day handwriting and 7th day handwriting, you yourself can understand that the difference. And that can be also one of the very important points where you yourself will be feeling more confident than before. If you want to read something, try to read newspaper. And if you feel that, no, I'm not so much comfortable and I'm getting headache or probably I'm getting backache, please ask one of your family member to read it for you and try to concentrate on the newspapers or probably any storybook as much as possible. Now, in the next slide, we will be talking about multiple cognitive distraction strategies that can be very much helpful during the course of treatment. Sorry, before going ahead with the distraction strategy, now we will be talking about the behavioral stress management strategies. So, regular walking is very much important. Try to walk at least 30 minutes per day. It can be 15 plus 15, probably 15 in the morning and 15 will be in the evening. Try to have a good quality of sleep, and that should be at least 8.5 hours. At night only, try to avoid sleeping more than 2.5 hours during the morning time. If you are active physically throughout the day, and also if you are engaging yourself into self-care activities and minimal household chores as well, you will be getting proper sleep at night. As a result, your mood will be improved, your physical energy will be increased as well, and also, as in the last slide, that the cancer related fatigue and the stress also going to be reduced to a greater extent. Now, we will be talking about the multiple cognitive distraction strategies. Total 3 types of cognitive distraction strategies that we need to follow. The first one is basically the 5, 4, 3, 2, 1 technique. Let's focus on here. Try to acknowledge 5 different things that you can see through your eyes. Try to touch probably only 4 things that you can see. Now, probably in front of me, I have my laptop, my pencil box, my mobile phone, and my water bottle. So I need to focus on those 4 different things. And also try to listen 3 different sounds, try to smell 2 different sounds, and also try to taste any sort of thing if that is in your house. For example, it can be salt, sugar, everything. Try to follow the 3-3-3 rule there. Try to look around and name 3 things that you can see. You can try to move 3 different parts of your body. Also try to name 3 sounds that you can hear. Also, let's focus on today, which is basically we need to focus on today, not for the future or not towards the past as well. Try to cherish each and every moment. Focus on what you are doing today, what you want to have today, what you are listening today, what all you would like to do probably within the next 1 week. If you feel that you are very much immunocompromised and you can't step out at home, try to play indoor games with your family members. It can be the chess, carom, or anything. Remember that it's all about the regularity and consistency. In the next slide, we will be talking how our caregivers can be very much helpful for the cancer patients for managing their quality of life. Try to reinforce and motivate your patient to do at least their self-care activities, for example, eating with their own hand, combing their own hair, or probably wearing clothes by their own. These small activities, do not try to be overprotective much. Try to celebrate anything that is happening in your locality or in your society. For example, it can be Diwali, it can be your birthday, anniversary, anything. That is really going to be helpful for the patients to uplift their mood. Also, it will be very much helpful to provide multiple distractions as well, so that they can control their negative emotional thoughts as much as possible. Now we are at the end of today's presentation, and in the next slide, I will be focusing upon only to the core areas where you surely need the psychological recommendations from any expert or psycho-oncologist. The first and the most important thing is managing body image. A psycho-oncologist is going to provide multiple cognitive behavioral modification strategy so that you can accept yourself the way you look now. Your new look, that is very important, and that's only you can understand. So it's very important for you to appreciate yourself the way you look. During the cancer treatment, our caregivers can also experience burnout because they're also human being, and it's very obvious because the course of the treatment is going to be very long here. So yes, a psychological counselor is going to teach you how to manage your own burnout as far as possible and as much as possible as well. Always remember, after the active cancer treatment, it's very important to adhere to follow-up or follow a proper exercise schedule, follow a proper psychological healthy routine and rehabilitation as well. As Dr. Nayak already explained that we have seen during the counseling session many quirks in our society. Our patients, sometimes by mistake, they will go to them, and later the prognosis is surely not going to be good. So it's very important here that we need to understand that a psychologist is going to be helpful for you to give you a clarity about what you need to do and why you need to do. It's really going to be helpful for you to improve your overall quality of life if you stay in touch with the psychological counselor and regular follow-up as well. Thank you, Aditi, and thank you all the participants.
Thank you, Jaitri, for this wonderful presentation, for explaining the importance of managing well-being through positive thinking and psychological counseling session during and post-cancer treatment so clearly. Now, let's welcome Ms. Sharmela Devi, Senior Onco-Dietitian. She will be talking about the importance of maintaining a good diet, side effects and comorbidities management during cancer treatment. Sharmela Devi has been associated with 4-Base Care since November 2020. She is a postgraduate in clinical nutrition and dietetics and certified in cancer nutrition. She is member of Indian Association of Parental and Enteral Nutrition and consulted around 1,000 patients in 4-Base Care till date. Over to you, Sharmela.
Thank you, Aditi, for the wonderful introduction. Namaste all. I am Sharmela, Senior Onco-Dietician. I help in dietary management during cancer care. I am here with you all to discuss the importance of diet during the cancer journey. Let's begin with the presentation. Let us start with the basics. Let us first learn what is health, balanced diet, and healthy eating, then move on to our main topics. What is health? Health is defined by the World Health Organization as the state of complete physical, mental, and social well-being, and not just only the absence of disease. The essential dimensions of health would include achievement of optimal growth and development, mental well-being, ability to combat disease, ability to withstand aging, and resisting infections. So what is balanced diet? A balanced diet is one which contains different types of foods in such quantities and proportions so that the need for calories, proteins, minerals, vitamins, and other nutrients is adequately met, and a small provision is made for extra nutrients to withstand short duration of leanness. In addition, a balanced diet should provide bioactive phytochemicals such as dietary fibers, antioxidants, and other nutraceuticals which have positive health benefits. Low glycemic index foods are much preferred in a balanced diet. A balanced diet should provide around 60 to 70% of total calories from carbohydrates, 10 to 12% from protein, and 20 to 25% of total calories from fat. Thus, a balanced diet enhances the quality of life. What is healthy eating then? Healthy eating index is a measure to assess how well a diet conforms to the recommendation of the dietary guidelines. Look at this food pyramid to understand better about this. As basis for the balanced diet, ICMR suggested food pyramid, which is self-explanatory. Healthy eating pyramid is a plan to help people choose the foods amounts that are right for them to balance with their daily physical activity. This is meant for any healthy person who is above the age of 2 years. What does this pyramid emphasize? Number one, be active. One has to do physical activity every day to be fit. Number two, vary your choices. The 6 bands stands for the 5 food groups plus an area for oils. Number 3, think in proportions. Number 4, make moderations. Number 5, customize. This pyramid is available for kids and also for vegetarians. They can be used according to a person's need. And number 6, improve gradually. Small steps add up to big benefits. So we have learned the basics of nutrition. Let us move on to the next slide to learn about the interesting topic, functional foods. Functional foods are taken as regular foods as a part of an uncommon diet and not in the form of dose, which provides physiological benefits beyond basic nutrition function. They are not pills or capsules, but a part of a normal food pattern. Food also act as antioxidants, detoxifying agent, and so on. Let's look into them a bit in detail. Antibacterial effect of food. The probiotics support intestinal health by inhibiting the overgrowth of toxic bacteria. Fermented dairy products like curds contain live cultures, which helps in preventing cancer. Antioxidant effect. Dietary antioxidants can be nutrients or non-nutrients. Dietary components identified as antioxidants are beta-carotene, vitamin A, C, E, niacin, riboflavin, and sulfur-containing amino acids. The diet should include foods rich in antioxidants, particularly fruits and vegetables, to prevent degenerative diseases. Blocking and suppressing effect of the food. There are other chemicals in foods which act by preventing potential toxic agents and carcinogens from reaching the target tissues by suppressing their action. People who consume soya foods rarely will surely experience breast, uterus, or prostate types of cancers. Anti-inflammatory effect. Monoterpenes and gingerols present in ginger have anti-inflammatory actions in musculoskeletal disorders. Detoxifying effect of the food. Foods which contain such detoxifying chemicals are cabbage, tomatoes, strawberries, pineapples, green peppers, in simple green and black teas. They activate liver detoxification enzymes and can reduce the incidence of tumors. Digestive and related effects. We all know spices in general stimulate salivation, acid secretion, and digestive enzymes. Spices are used to reduce flatulence. For example, omam or ajwain is a household remedy for indigestion. Asafoetida has a similar effect too. Fenugreek is used in buttermilk in the treatment of dysentery. Hypocholesterolemic effect. Soya protein reduces the plasma cholesterol concentration due to the presence of isoflavones. Garlic also reduces plasma LDL cholesterol, which means the bad cholesterol, and the triglyceride concentration also. Hypoglycemic effect of food. The soluble dietary fiber fractions of fenugreek seed is known for its hypoglycemic effects in humans. Beans and whole grains positively affect blood glucose management and insulin sensitivity. Immunopotentiating effect of the food. The immune response may be further enhanced when one or more probiotics are consumed together and work synergistically. Thus, food has many functions other than just being nutritive. Let us move on to the next slide now to be aware about the dietary factors that increases the risk of cancer. Foods may cause cancer by being a direct carcinogen, or carcinogens may be produced by cooking. Meat. Meat intake has been positively associated with the risk of digestive tract cancers and breast cancers. Intake of red meat such as beef, lamb, and pork and processed meat increases the risk of cancer. I have noticed that there is a question on red meat in a question and answer session. So I hope this would answer your queries. Energy balance. Physical inactivity, high energy intake, and large body mass are associated with increased risk of developing colon cancer in men and women. In breast cancer, a positive association with weight gain and increased waist-hip ratio is seen in postmenopausal women. Sugars. This question was answered by Dr. Sandeep Nayak sir also. So let me give a bit more better answer for this. Consumption of simple sugars may be related to colorectal cancers, but one must always keep in mind to keep their comorbidities under control to control their disease progression also. Excessive starch foods may also predispose to gastric cancers. Fat intake. A high intake of saturated fat increases the risk of prostate cancer and may be related to colorectal cancers also. Vitamins and minerals. Deficiency of folic acid and vitamin A and C have been associated with the development of cervical cancers. Alcohol. There are studies indicating that alcohol has a casual role in carcinogenesis, especially for cancers of the mouth, throat, breast, pharynx, and esophagus. Nitrosamines that are present in tobacco and tobacco smoke. These are potent carcinogens and may cause nasopharyngeal, stomach, and colorectal cancers. Aflatoxins. The fungi which grows on cereals and groundnuts can cause liver cancers. Hope I have given a better idea about the risk factors that increases the risk of cancers when it comes to diet. Now, let us move on to the next slide to understand the evidences of the same that was discussed in our. Studies from Japan, which is a low-frequency region for breast cancer, has shown that reduction in risk was associated with milk and green-yellow vegetables consumed by pre- and post-menopausal women. Traditional Japanese diet with fish were more beneficial in post-menopausal women, so did the fruit consumption also. Early life diets also influence adult onset of breast cancer. Studies from Harvard showed that adolescent consumption of eggs, vegetable fat, and fiber was associated with a lower risk when compared to women who consumed more butter. Physical inactivity, high energy intake, and obesity are associated with rectal cancer, and there is a probable synergistic effect among the three risk factors. Animal fats are not only associated with large bowel cancers, but also with the benign tumor or adenomas. According to the study conducted by scientists from Harvard Medical School, participants with a high consumption of ultra-processed food had a higher BMI, who are less likely to exercise regularly, higher rates of diabetes, had an increased risk of cancer. Hope the evidences are enough for you to prove the dietary impact on cancer. Now, let's move on to the next slide to learn on our main topic, cancer and its impact on health. Neoplastic disease is commonly associated with three basic systemic effects: anorexia, hypermetabolic state, and negative nitrogen balance, often accompanied by increased weight loss. Abnormalities in metabolism. The extreme weight loss and weakness is caused by abnormalities in glucose metabolism, in which cancer patients cannot produce glucose efficiently from carbohydrates and instead feed off their own tissue proteins and convert it to glucose instead. Anorexia, it may be often intensified by fatigue, pain, fear, depression, or can be developed due to the consequences such as treatments like surgery, radiation, and chemotherapy also. Anorexia will lead to weight loss and malnutrition. Many factors appear to play a role in wasting associated with cancer. The combined effects of poor appetite and abnormal metabolism result in lower supply of energy and nutrients as instances when the demands are high. Malabsorption. This can occur due to blind loop syndrome. The associated overgrowth of bacteria in the upper small bowel may result in steatorrhea and vitamin B12 deficiency. Fluid electrolyte imbalances. Vomiting and diarrhea not only bring losses of water, but also cause loss of water-soluble vitamins. Anemia. The underlying problem of anemia may be compounded by a number of factors, including anorexia and malabsorption of dietary nutrients. Taste and appetite changes may be due to psychosomatic factors such as fear, pain, and side effects of medications. The fear by the diagnosis of cancer and its outcome, and the stress of diagnostic procedures. Those stresses can cause learned food aversions. Hypercalcemia. This is one of the most common metabolic complications of cancer. Approximately 20 to 40% of the patients with breast, squamous, bladder, and renal carcinoma develop hypercalcemia at some point in their disease. And osteomalacia, generally like the gastrointestinal malabsorption of calcium and phosphate is observed here. Resection of the tumor actually corrects the bone disease in such cases. So we understood the impact of cancer on body. Now let's move on to the next slide to see about the cancer treatment and its side effect in human body. Cancer treatments are designed to target and destroy cancer cells in the body. Cancer treatments such as chemotherapy, radiation therapy, immunotherapy, and so on. They have various side effects. It's important to note that not all patients will experience these side effects, and their severity can vary from person to person. Additionally, advancement in medical research and technology aim to minimize these side effects. Here are some common side effects I have listed out in this slide. They are associated with different cancer treatments. They are like nausea and vomiting, loss of appetite, constipation and diarrhea, mouth sores, ulcers, tiredness, fatigue, sore throat, dry mouth, difficulty in swallowing, and so on. These side effects lead to malnutrition, and malnutrition during treatment can lead to negative consequences such as increased risk of infections, treatment toxicity, increased healthcare costs, and decreased response to treatment. This will affect the quality of life and life expectancy also. Let us move on to the next slide to understand how to manage these side effects. Some tumors change the way the body uses certain nutrients. A patient may seem to be eating enough, but the body may not be able to absorb all the nutrients from the food. Cancer patients may have anorexia and cachexia at the same time. Here, I would request all our participants present here to note down these dietary tips I'm going to give for you for treating the side effects you might be facing, or you may be facing now, or you may face in the future. Loss of appetite. This can be treated by including spices such as cardamoms, cloves, and cinnamon in drinking water. Nausea and vomiting can be treated by simple ginger teas. Dry mouth can be treated by frequent sips of flavored water. Sores in the mouth or throat can be treated by consuming coconut milk in empty stomach regularly. Trouble swallowing. This can be treated by altering the consistency of the meal to semi-solid, soft, or full liquids. Feeling full after eating a small amount of food, this can be dealt by taking small, frequent meals. Constipation. There is a very good remedy for this. Regular consumption of 1 tablespoon of flax seeds post-dinner will surely help in constipation. Not only side effects management, comorbidities management is also very much essential. Comorbidity is 2 or more illness occurring in the same person. It includes any one or many of these such as diabetes, hypertension, chronic kidney or liver disease, obesity, and dyslipidemia. In addition to cancer diet, incorporation of restrictions for comorbidities will also help in better treatment outcome. Keep in mind, as I have already told, controlling the comorbidities is very much essential to control the cancer cell progression. External factors. Please note cooking method and cooking vessels also play an important role in nutrition. Most of us are confused about this because there are lots of different vessels available in the market. To be short, Cooking in iron vessels adds on iron to the food and helps in improving the hemoglobin. Cooking foods in clay pots helps in changing the pH of the food, which is very much suitable for the human body and helps us live healthy. Cooking in stainless steel does not have any negative effect. Storing, when it comes to storing the food in glassware and ceramics are much better than using plastic containers. Cooking in aluminium, indolium, and non-stick will surely add toxins to the food and degrade the nutrients, making the food less in nutrition. So better avoid them. Also avoid regular consumption of pressure cooked foods. This will cause bloating and gastric issues. When it comes to cooking methods, boiling and steaming are the best in comparison to frying and grilling. Frying will add too much fat into the food, and grilling, because of grilling, there may be carcinogens produced in the diet. So these are all the challenges that lead to malnutrition, and subsequently the tolerance level towards the treatment may go down. Moving on to the final part, I would like to conclude here. It is simple as it is. Maintain a healthy body weight. Do regular physical activity to maintain healthy weight. Reduce your fat intake, particularly from animal sources, and avoid refined foods as they will increase the risk of cancer. Eat plenty of whole grains, fruits, and vegetables to meet antioxidant and fiber requirements. Avoid smoking and consumption of alcohol. Though there are so-called safer limits, studies still say that there are also reasons for increasing the risk of cancer. Keep in mind, food is thy medicine. Thank you all, and over to you, Aditi.
Thank you, Sharmela, for explaining the importance of managing well-being through proper diet during and post-cancer treatment so clearly. Once again, thank you to all our speakers. Now, we will move on to our question and answer session. I would like to request all our participants to type their questions in the chat box. Please feel free to ask questions in any regional languages as well. Our care companions will help to translate those questions. We have received one question. What to do to make patient accept the truth and empower him or her to fight the disease? Commonly, patients generally breaks when they hear the diagnosis and just become silent and avoid any talks or work.
Thank you, Aditi, and thank you, the participant, sir, ma'am, for asking this question. So before starting this, we need to understand that there is a concept called DABDA, which is called DABDA. So which starts from denial, then it ends at A, which is called acceptance. So it's a long process. So what we say as a psychologist, if you are aware about the diagnosis on the very first day, you will be in a denial phase, then you will be angry, and then you will be in a bargaining phase, then you will be in a, slowly you will be on the acceptance phase after the depression. So I will request you to give your patient some time, because if he is in a denial mode, to reach to the acceptance phase, it is going to take some time, but probably he just doesn't want to talk about it. Just be his or her side, ma'am. Slowly, eventually, we are sure that when he will cross all these stages, surely he will start talking about it. But one thing that I will recommend you to do, be very conscious about the topic that you are discussing at home regarding the patient's diagnosis. Do not try to make the very chaotic situation or a very fearful situation, rather than just try to make it as normal as possible, as of it's just like a fever or probably it's just like a cough. So it's up to us how we are interacting with the patient, and but mostly give himself some time. He will surely going to accept slowly.
Thank you, Jaitri.
Thank you.
Second question we have received. Using of pressure cooker to cook food is not advisable in cancer. Can you let us know why? Generally, health fraternity says to avoid pressure cooker cooking in daily cooking method.
Hi, Aditi. Thank you for the question. So let me explain here. So there are grains and pulses we are supposed to soak grains and pulses at least for 30 minutes so that few enzymes present in these grains and pulses will get deactivated before they get into our body. At the same time, we are supposed to open cook them, not pressure cook them. The reason is when we open cook foods, those enzymes gets released into the air. They do not get stayed in the food. When few enzymes such as pectins at all get stayed in the food, they will cause bloating and other gastric issues. That is the reason it is always best to open cook pulses and rice. That is the healthier method also.
Another question we have received. Post my breast cancer surgery, I can sense being distant from my husband. What to do?
This is the least discussed topic in India and in our society as well. And I'm sure that, ma'am, you are talking about being distant from your husband physically. So the first recommendation that I will tell you, that be very clear with your husband and try to practice an open communication about what you want and what you desire, and please try to ask him about his need as well. Sometimes there is a probability that your husband is probably scared that during the being physically intimated, probably he may hurt you. That's the most common the feeling that husbands usually get if the wife is a breast cancer patient or a survivor. So it's very important that please try to have an open communication and try to ask his need. Also, don't hesitate to express your need and desires as well. But always remember that there are multiple sort of techniques to have intercourse as well, that if you come to us for a good psychological session, surely we will going to help you in that so that your sexual life can surely be as good as others. Thank you.
Thank you, Jaitri. Another question we have received. I'm the caregiver of a breast cancer patient. We are from a middle class income family. I feel eating healthy is costly. Can you please guide me to afford for cheap healthy foods?
Very good question, Aditi. So actually eating healthy is not costly. We have to come out of this myth. So when you go for seasonal foods, like seasonal fruits, seasonal vegetables, you can afford for a cheaper, healthier foods. And even there are very good sources of fiber and antioxidants that is available in our own millets. Millets are not that costly. It is in our hand to choose wisely. So always go for seasonal vegetables, seasonal fruits, so that you can consume healthy foods regularly.
Thank you so much. Now, please check out our new digital healthcare product, Oncobody application from 4Basecare. It's a 360-degree digital healthcare platform that aims at building a unified and patient-centric ecosystem to provide holistic support to cancer patients and caregivers in their fight against cancer. From Oncobody, patients can book their consultation with treating oncologist, counseling sessions from psychologists, dietitian, pain and palliative care specialist. They can upload and manage cancer reports from oncologist. They can post any queries in community section. Our experts are there to answer the queries. Now, we are at the end of today's event. There were lots and lots of questions and queries asked, but due to the restriction in time, we could not answer all the questions. Jaitri and Sharmela are available in Oncobody 24/7 to answer your questions. Now, this is our, you can check the application Oncobody link share in the chat box. You can directly install it to our phone using your Google Play Store. You can update it occasionally. Now, this is the Facebook page Oncobody Cancer Community. You can follow the Oncobody Cancer Community Facebook page from here. And you can also scan the QR code. Also, please feel free to share your feedback on the meeting so that we can constantly improve. Link is shared in the chat. It was great interacting with you all. For any query or booking your counseling sessions, please call to our central number+6366843415, or you can mail us at info@4basecare.com. To connect with Dr. Sandeep Nayak or Max Clinic Bengaluru for any cancer treatment related queries, please call 9482202010 or 9482202240, or you can mail at support@maxclinic.com. I would like to express my sincere gratitude to all the patients from Max Clinic Bengaluru and the speakers for being present in today's event. Today, this initiative has helped to raise awareness about importance of enhancing well-being with right knowledge, positive thinking, and diet during post-cancer treatment. Apologize for overshooting the time, but it says it was useful and informative. Once again, thank you to everyone who made this event possible. Thank you all.